Good evening and welcome to IHW Council's special web series on women's health. I'm Anisha Dhawan and you're watching our exclusive show on infertility treatment and care during COVID-19. The ongoing pandemic has raised serious concerns amongst everyone, and women are certainly bearing the brunt of it. The impact of this virus on their pregnancy, childbirth, family planning, and even more regular and common needs such as menstrual hygiene, nutrition, and many others are some of those issues that are bothering them. The other thing that causes them immense anxiety is the inability to conceive. There is a section of our society that is suffering from this problem. In fact, infertility over the years has emerged as one of the most common health issues that many young couples have been facing. In fact, according to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of the Indian population. In fact, this is worse in urban areas where 1 out of every 6 couples is impacted by this problem. Now, today's show is special as we are going to discuss every aspect related to infertility and how impacted women and couples can address this in the best possible way in the times of a pandemic. And to guide us for this, we have Dr. Hema Divakar, Medical Director of Divakar Specialty Hospital, Bengaluru, and CEO Artist, who's joining us to help answer all your queries. Good evening, Dr. Divakar, and welcome to the show.
Hello, Anisha. Namaskar, and hi, everyone.
So before we begin our conversation, I would like to reach out to all those who are watching this. Please do send us your questions. You can just type in the comment box, and ma'am will be most happy to answer all the questions that come in. And today what we're going to talk about is actually how to manage your pregnancy after you have conceived, having taken some sort of infertility treatment. So if you're in this stage, or if you're hopeful of getting to this stage and you have questions, do send them in. So, Dr. Divakar, let me start by just asking you, how should one take this pregnancy post-infertility treatment? There is one school of thought that says, so there was a hiccup till you got to conceiving. After that, it's normal. Pregnancy is so natural for the body. No need to sweat about it. Don't get anxious. The other school of thought says, it's been such a difficult journey to even get here. You have to be extra careful. Don't take the stairs. Don't carry anything heavy. Take it as easy as you can. Where are you when it comes to both these school of thoughts?
Yeah, Anisha, I must tell everybody a fantastic caption you've given for today's program, saying that you're infertile and you've got to the stage of pregnancy and the new battle begins. Yes, because the 9 months, the very precious 9 months, a significant 9 months, an important phase in their life, suddenly it's not a total relief that they have gotten pregnant. Yes, they are the lucky ones who have, but those who have not undergone the infertility treatment and got pregnant also start with some level of anxiety, because pregnancy means whether everything will go well, and 9 months seems the longest period in life, if you ask me, because every stage and before every visit to the doctor, there are so many questions in their mind, but the ultimate thing is all will be well, na doctor? That is what they will always come up with. So infertility couples who have, in the first place had some issues with conceiving and they have gotten there, you can quite imagine that anxiety is already inbuilt. Okay. And then they know that another 9 months, the carry home healthy baby is actually the end point. Not just getting pregnant, actually taking a healthy baby home without any problem to themselves or the baby. So till they get to that stage, yes, they're in a very heavy state of anxiety. But we have to proactively tell them, as how we tell all our patients, that yes, anxiety is a given. More you go and seek help from Dr. Google, it'll double your anxiety. And the more you listen to the casual conversation, the WhatsApp forwards, and the groups of friends that you have, each one with their own experience or limited knowledge, will tell you one thing or the other. So all these hearsays confusing one mind, that we have to remember. And to top it all, like a wound is spiced with salt, we have the corona pandemic. What else did you need? If you're conceived with the infertility treatment and you've gotten pregnant in this age, where we as medical practitioners also have a limited knowledge of how this will really impact your pregnancy. So we are also a little bit anxious, and coupled with your anxiety, that is why we have to be very sure in making proactive efforts to allay this anxiety, to be in a positive state of mind, and to reaffirm to ourselves that all will be well. And if there are challenges, we are going to circumvent it. It's better always to start with that mindset, given the choice. Okay, so I would urge each and every person who is watching this show, yes, the anxiety will be there, but place it in the back of your mind. Don't bring it to the forefront. Yes, it's a healthy anxiety, which is okay, welcome, because you need to be cautious. You cannot be complacent. You cannot just ignore and do anything. Yes, you'll listen to your doctor and you'll be compliant with her guidance, but the self-confidence and the reaffirmation to yourself that, yes, I'm going to make it and all will be well. That mindset is so crucial, so very crucial.
Right. So, Dr. Divakar, you brought up the issue of COVID-19. Now, so far, there isn't a lot of evidence to suggest that if the mother has the coronavirus, she passes it on to her child, her unborn child, or the child even during delivery. In fact, we've heard of cases where women have the virus, they've delivered the child, they have breastfed the child without any negative, outcomes or without infecting the baby. So should this really be a worry at all? The corona factor.
Actually, overall, you keep the worry factor as minimum as you could, because if you want to be worried and if you start getting worried, then there'll be no end to it, because corona will only add on to it. That is, again, I reiterate the same message. But given the limited amount of knowledge and literature, we do speak to the doctor colleagues all over the world, and we discuss amongst ourselves that every day there is a new information. Every day there's a new thought as how the data is escalating, because what we thought was never the case is slowly turning to be in the probable bracket. And from there, it's going on to, hey, so many people have gotten this, that, and the other. So maybe the cause and effect is. So we are still studying the situation. But the good news is that, yes, first we started saying, no, the whole series in China did not show any vertical transmission. So be reassured, your child, it will not pass on through the placenta. So when it's in the womb, it will not get. That was the first phase. Then in the middle, we got the data that probably it can, because there are few babies who have the antibodies. So now we are more or less sure that, yes, in a theoretical way, there is no reason why it cannot pass on from you through the placenta to the child. But again, the data available till now is that there are no serious implications or damage to the immediate and near immediate management of the child per se, because though the infection has been there, all children have done well. One of the basic reasons for this is, it's a very interesting scientific fact, which thank you for giving me the opportunity to do so. The virus has to go and latch on to a particular type of a receptor. Okay, it's like a lock and the key. Okay, so little babies don't have that receptor ready yet. Okay, so this virus cannot go and latch on to anything. So
you're saying the receptor, the babies don't have the receptors in the lung cells, so they don't go and latch on. Is that what you're saying?
Yes, because it requires a particular, it's a lock and key mechanism where it has to go. So that particular type of receptors is still in the phase of development for the newborns. And that is perhaps the reason why, though the infection may be there, though the antibodies also passed on, but we've often not had any serious issues at hand with the newborns. Having said that, the readmissions of these babies, of COVID positive mothers, and the long term, that is still to be seen, because there may be some damage to the brain or some damage to the functioning as how the baby grows and its milestones start evolving. Then maybe this, that, and the other. And therefore, it is absolutely, absolutely crucial for anybody and everybody, the healthcare professionals who are handling the COVID-19 infection cases anywhere in the world, they have to fill in the data into the registry, because only on reflecting on that, we would know what the true story is. Having said this, one last thing I want to tell about this, that 80% of the pregnant women who may be carrying the infection do not have any symptoms. So if you do not test, you will not even know. So there may be so many who have already gone through the pregnancy with good outcomes or with not so good outcomes, but they don't know they're COVID positive. So we don't know that those children were ill or the patient was ill because of. So you can just imagine what a gray and a hazy zone that is. Therefore, if you just believe that things will be well with the limited knowledge that we have, yes, we are making all kinds of notes on every little thing that we see in the mother and the baby in this phase, because it will or it may come of use in the near future to tell the world about what really is happening to the pregnant women and the little babies.
Right. Mark, we've already started getting a few questions from people watching this, and I would, implore everyone watching, if you have questions, please send them in. But before we get to the question, I have one more question to ask of you. Ma'am, you're running a center in Bangalore, I believe. Now, I want to understand, if I'm pregnant, if I just became pregnant after, undergoing infertility treatment, I believe that the protocols are more strict, more visits to the doctor, more sonographies, and greater monitoring happens. How do I ensure I stay safe? What are the measures I should take, and what are the measures I should look out for to ensure that I am safe when I go to a clinic?
Okay, as you rightly pointed out, Anisha, the frequency of visits, both because to reassure ourselves and reassure the patient also, and just in order not to miss anything between one visit and another visit, yes, we look at these pregnancies a little bit more differently. I should be saying the truth that yes, we don't want to take a chance on anything that could be prevented or could be corrected, or early detection. So their visits are much more frequent. But in the COVID times, when as a general rule, we tell the women that please limit your visits to the hospital, because hospitals are the hubs where you can pick up the infection, and therefore just video call or chat or make a phone call and just do the telemedicine kind of a consult with your doctor, because many a times we may not require you to visit in person and we can guide you accordingly. But yes, the enhanced tests and the check of the patients should not be compromised just because of the corona pandemic. And every hospital, we call it the preparedness for the COVID-19 infection, because we're training massive number of healthcare workers about how each one in the setup should behave, and only one relative with the patient. At the entrance, they're hand sanitized and they have to wear a mask, and the patient to patient distance also, the social distancing, what we call, that is to be maintained. And even when they visit the doctor, the same applies of repeated hand washing. Even the ultrasound cables, after every patient we have to disinfect, and there's a lot happening. But with due precautions and seriousness about all these preventive measures, anyone could be as safe as they can be. That is the message. Don't take anything for a chance. Of course, nothing is to be called as overdoing. Yes, it is your precious 9 months. Better to play safe than sorry. So even if somebody is like, teasing you that you're just getting too much worked up and you're washing your hands 10 times, so be it. That's the thing which is required for the preventionary measure. So you should fall in line with that.
No, better be safe than be sorry, actually. Let's start taking up some of the questions that have started coming in. We have received a question from a Facebook user. Her question is, can PCOS be cured permanently? Is it a disease that needs curing, or is it a situation that needs management?
The PCOS pandemic in the minds of women of all age group beats the corona pandemic hollow, because no matter on any conversation I'm with, on any forum, there is one question on PCOS for sure, and that's the first question that has come in and you've taken up. PCOS is polycystic ovarian syndrome. Okay, it was originally called PCOD, if you can recall, that is polycystic ovarian disease. Why the D has been plucked out and S has been added? Because this is not a disease process. This is a pattern. It's like the stars get into a pattern and you call it Libra or Sagittarius, for example. So like that, there is a pattern of symptoms and signs which fall into a group which qualify you to become a label as PCOS. It is something happening in your ovary. Your ovary, if you see on the scan, it looks as if it has a string of pearls around it. So that string of pearls is many tiny water bubbles. Many means what? Poly. Cyst means what? Water bubble. Where it is sitting? In your ovary. So polycystic ovary syndrome, which means it's a pattern. What is the pattern about? What else is there with this? The ovary should look like that. Some of your hormones will be haywire. You may have more acne. You may have hair growth in the wrong places. You may have dark patches on the skin. You may have tendency to become more obese. You may have problems with your ovulation and fertility, and so on and so forth. It has a nexus with very many other problems which are hormone based. So that is polycystic ovarian syndrome. That's what it's called. It's not a disease process, and therefore it is not a disease. So in that sense, there's no cure for that. It's a pattern which you've got to live with, because your ovaries are your ovaries for your lifetime. But depending on what other components are in this puzzle or in this pattern, that will define what kind of a management protocol you'll need, what kind of treatment you will need. But basically, please believe me, 80% of this pattern gets reversed with your lifestyle changes. Because this is the core of this. It's a hard technical medical thing. The core of this is insulin resistance, and that plays around very well with the lifestyle, the diet and the exercise pattern, reduction in your number of fat cells in your body which manufacture the wrong kind of hormones. Simple to say, difficult to execute, and also difficult for many of you to believe that the lifestyle change can impact the pattern so very positively that you can then consider yourself to be cured. If you wish to say that to yourself, the pattern changes. So that's the cure. Okay. So, and this has to go on forever and ever in your life, that disciplined lifestyle, because this is a pattern which is underlying in your ovary for your lifetime.
All right. So, ma'am, when you're saying lifestyle changes, what are the lifestyle changes you're talking of? You said it's got related with insulin resistance. So, should you keep checking your sugars every day? Should you be exercising every day? Should you be fasting overnight? How do you manage your insulin and hence manage your PCOS?
Yeah. See, this insulin resistance, that's why I said it's a complex medical issue to explain. But suffice it to say that if the pattern is PCOS, what the hormone interplay will be, that it will interfere with the action of the insulin in your body. Okay? Whereby everything gets accumulated in your body fat. And the fat cells are the manufacturing storehouses of hormone production, which is the wrong kind of hormone. It turns into a testosterone hormone, the wrong kind of hormone. So if you exercise, you will burn your calories. So you will lose the X number of fat cells, which is equivalent to many factories shutting down. The manufacturing process will be not in 100 factories, but only in 10 factories, because those many fat cells you have lost because of your constant exercising. The 10 factories can manufacture only this much of a wrong hormone. So there, the changes, the alignment of the hormone completely changes. Therefore, one hand is burning the fat. Second prong is you should not allow the fat to accumulate in your body. Yeah, so what goes in has to come out. So if you eat a nice pastry or a oily substance or a frank sweets like gulab jamun, and then do not exercise to burn it out, it's all going to create more number of fat factories in your body. So the lifestyle is essentially the diet and exercise, and diet with less carbohydrates, more proteins. Okay? So when we say this, you got to quickly look at your mobile. There are so many sites which give you what your
Nutritional
favorite
information.
dishes. In your favorite dishes, go and see which has the least carbohydrates, most protein, and a little bit of fat. Then you would have done well for yourself, because there are many junky foods which are healthy. So it may just look like junk, but it is healthy. But French fries and pastries, etc., are a clear no. It also depends. If you fruits and vegetables, when you say don't go and have a canned fruit juice, that is like really high calorie and lots of carbohydrates. But have fresh fruit. So it's an apple with a skin. So it has the fiber also, and it'll digest better. So lifestyle is, you got to understand what you're doing and why you're doing, instead of just going and crashing on some diet pattern, and it won't last long. Then you're back to square one, and you're back with your disappointments and depression, and that should never be the case. Yeah?
Right. And there's a question coming in from another user on Facebook. The question is there any medication to control facial hair growth and hair fall due to PCOS? It's just about a medication.
Yeah, just one more thing I wanted to add, with the lifestyle change also immensely helps you for the fertility concerning issues, because that may be perhaps one of the key advices that your doctor will give. First you lose some weight and then you come back to conceive, and it never really happens, because people don't believe that weight loss may translate into a better fertility potential. Okay, so this question was about the abnormal hair growth. Unfortunately, the tablets that you take, they're not very selective in getting rid of the hair growth on your chin, for example, or on your cheek, because it will act in a manner that you may suddenly start having some bald patches in your head as well. Therefore, most of the times, though some newer preparations have come which can be given orally, which they don't have a selective action, that's our apprehension. And therefore, most of the time, the cosmetologists, the beauty parlors, and the dermatologists, they are in the forefront of tackling the excessive abnormal facial hair growth, unfortunately. And the hair fall, on the other hand, yes, there can be some medical reasons, like the issues with your thyroid hormones, etc. But lack of vitamins, which do not support the hair roots and make them very easily fall. So that can also, and stress is another reason where you will lose your hair. And PCOS, the hormone pattern, gives you the male pattern of baldness. So that also is an issue. So hair growth, hair loss, yeah, both are more than anything else. The cosmetic and the psychological problems with these issues can be huge, much more than what one can imagine. The one who's going through will know what they've gone through. Yeah, that's why these questions pop up ever so often. Yes.
Right. Ma'am, there's another question coming in. How long does it take to get pregnant with IVF? Is PCOS hereditary? Is there ever a timeline on how long does it take to get pregnant with IVF?
See, for IVF, you have to count it as one cycle, one menstrual cycle. Okay, in that cycle, they've done the procedure. So it's a make or break. If you get pregnant, it's 100% for you. If you don't get pregnant, it is 0%. Okay, so the number of attempts, every attempt, it's a you have to keep your fingers crossed, because if it clicks, then that's it. Okay, how many attempts can you get? Maybe 3 to 4, and then you have to change the methodology of ART, what we call artificial assisted reproductive technologies that do that. So the time span as such, it depends on how much time you have been with the medical care for a variety of other processes and procedures ahead of IVF. So that is your whole long journey for infertility, really. It's not that IVF cycle, and you cannot put a timeline on that in a sense that it's only that month, which is a make or break. But if you've started with some simple things as just the lifestyle changes and the timed intercourse, and then the a few medications to enhance ovulation, and some processes like intrauterine insemination, for example, which are simpler and less expensive than IVF. If you deserve that, your doctor will definitely suggest that. And then you move on to the higher and higher, and with smaller and smaller percentage of people will really need it. So when you're in that bracket of not being able to conceive, even a delay of a month, 2 to 3 months looks like it's been really long, because it's like the time doesn't seem to move at all, and you are worried of how much more longer you need to cope with the same situation. So that's how it is.
Right. Ma'am, the other question was, is PCOS hereditary?
Yeah. So the PCOS usually, because I said it's a pattern, so even the insulin resistance pattern runs in the families in a way, because it's all the programming which happens when you are in your mother's womb. So the ovaries, the developmental process is such that the insulin resistance can be programmed in the ovary of the child in the womb. In that sense, it is genetic. Okay, because when you ask for diabetes, you say, did your father have it, did your uncle have it? So this is all again insulin resistance and the genetic lineage that it is. Having said that, even if your parents are not diabetic, how did I get diabetic? That's also a question which can come to your mind. So please do remember, don't blame everything on heredity, because genetic and epigenetics, that's the cap on the genes, because these genes may be present, but it will unfold if you do not regulate your weight, if you do not regulate your diet, do not regulate your stress, and you add all these external factors or the masala to the main core gene that you have, then you will become a full-blown, the worst kind of PCOS or the worst kind of diabetic. So that is why you have got to pay attention to what could be done to prevent, even if you're genetically prone. We call it genetically prone because you say, okay, somebody in your neighborhood is doing all the wrong things, but still nothing is happening because they don't have the genes in them. But if you do have the genes, can you still contain it? That is the main issue that you got to recognize, that if you still have the gene, there is a pattern of behavior which will not let your genes unfold and blow up into the symptoms and the disease process which you may get into later. So yes, typically even the menstrual pattern, we ask the mothers and sisters, and age at menopause, age at the first the menarche, what we call. So all these, yes, it has a weave or a thread along the generations. So the pattern could be somewhat similar in the siblings and the family, but each one will present very differently even in the same family.
Right. Ma'am, another question is, are there any side effects associated with IVF? And another user is asking, does IVF increase the chance of twins?
Yeah, both questions are very relevant, because any medical procedure that you undergo, or any tablet also that you take, the first question that you will ask, is there no harm? Because even for us as doctors, do no harm. That is our first dictum. So all the known procedures and all the permissible medication as per the recommendation and the protocols is what we will use. But very occasionally, the same dose of medication in 10 people, one may react a little differently. So you may label that this is one rare patient who has got it, but that is why there is something called the monitoring. Whenever we put the patients on any array of medications, we will always monitor to see whether it's suitable to that patient. So in that sense, with the due caution taken by the healthcare providers, as in the specialists, the side effects will be minimal. The procedure per se, a few things that the patients are always worried, whether this will cause birth defects, this will cause other complications in pregnancy. No, once you get pregnant, it will be, the due caution has to be taken, but most likely that the chances of everything else will be as per any other pregnancy. And Anisha, remind me of the other question that about IVF being
leading to a greater chance of twins. That was
twins.
the
Yes,
question.
certainly, because I said in the journey of the assisted reproduction, if simple things or simple advices do not work, then one of the first things that we do is to give some medication to make your ovary
Produce more
really
eggs.
work better. It's called ovulation induction. That means you push your ovaries, you induce. You know, like a vehicle doesn't start, the first thing you do is to push the car. So you will give these medications to push your ovary to do its best. And in that process, instead of producing one egg in a month, it will produce multiple eggs. So that has really given a huge escalation in the number of twins that are now seen in the pregnancy population, for sure. Yes, that is correct.
Ma'am, another user is asking, what other methods are available besides IVF, I guess, in the entire umbrella of ART, other than IVF? What are the other options available?
Yeah, somehow, you know, IVF, in vitro fertilization, is a very often used common terminology. So that whole bracket of those who cannot conceive, the first word that comes in assisted reproductive technologies is IVF, because that's the most, you know, something that everybody is familiar. But as I said before, first of all, the causes it's not like a straightforward cause in every couple, because it's a mix of so many things, and sometimes there may be a single factor which is not allowing her to get pregnant, fall pregnant easily. There may be multiple factors in the same woman, or there may be some factors in the woman and some factors in the partner or the husband. So it's a complex mix of, you know, so many things that we have to tease out. And even if we do the entire range of investigations, there is still a small segment of unexplained, because of the available tests. You've done everything, but still you cannot come to a conclusion why the pregnancy is not coming through easily. Then it, you know, we just say, oh, it's unexplained. You know, and many a times in this corona pandemic, many had to stop their fertility treatments, and few of them have fallen pregnant on their own. Okay?
Yes,
Which
because
means
a
in the
lot of
first
people
place,
got relaxed. You know, they got relaxed. They weren't running around. And it is actually documented that the number of pregnancies plus abortions have gone up during this time.
Yes, certainly. So that is also not a myth. It's a true situation which has happened, which also brings home the point that yes, it may just be an anxiety and you're rushing to the doctor unnecessarily. What the nature would have done, you're not even allowing the nature to perform its duty, and like over medication, you know, which is not good for you. Sometimes overcalling your own situation of infertility and going in for assisted reproduction when you don't need it, that can also misfire many a times. Then the simplest thing is to tell the patient about when is the fertile period and when it is ideal to you know, have intercourse to conceive. Then the ovulation induction, because that comes in the major bracket of the calmness problem. If you have a headache, you'll say, okay, maybe it's sinus problem. You not think of a tumor, you know, in your head. So that way, you know, that's a calmness bracket. Then, okay, the semen sample testing is done and it is inappropriate. Then intrauterine insemination, because you have to filter the good quality sperms and place it in the womb, or it may have to resort to donor inseminations. IVF typically is the egg and the sperm meeting outside of your body. So in vitro means outside. So that is one technology. ICSI is another. In ICSI and IVF, what is the difference? In IVF, it is one egg and then you float many sperms. Anyone can take its chance and go and hit the egg. Whereas in ICSI, it is one egg and one sperm that is to be placed right inside that egg. So you know that this is the sperm which is getting to meet that egg. So that is ICSI is another procedure. Then there are some more complicated processes which your doctor would explain as to the TISA and the PISA, all these acronyms. So they you can definitely always Google it and see. But there are more and more refined method to make the same thing happen. the product called the embryo, the 2 cell, has to get created by mating the egg and the sperm. How you do it and how the techniques differ, that's the slight tuning of the techniques that the doctors will do, because depending on what would give you the best chance for and what is most appropriate for you. Yeah?
Right, ma'am. One more question that is coming is, what is the upper age limit for IVF treatment?
It depends both on medical and social and legal factors. Because the legal battle is always on. Anytime you see the flash in the newspaper that somebody very proudly claims that a 65-year-old got pregnant with this, that, and the other, and there are another 100, commenting that why can't you just see, is this that she had the right, or that she doesn't have the right? If the technology advances, why not, etc. So that's a whole legal battle that is going on. But the thing is, what is your age and what is your ovaries age? That can be in discordance many a time. Okay, you may be a 45-year-old, but your ovaries may be behaving like a 25-year-old. Perfect balance of hormones, very good quality eggs. Something which can be done easily, because nowadays late marriages are also, you are seeing that even if they get married at 38 or some of them can very easily conceive, not that their age only is a time. Whereas the reverse can also happen. You may just be 25, but your hormones and the ovulation pattern may show that things are not up to the mark, so your ovary has aged. There are certain tests where we can predict the fertility potential or the fertility status, irrespective of your chronological age. So whether you're 25, 35 or 45, you may not just by default label the elderly as being less fertile. So these kind of information has to be stored in your mind in order to allay your own apprehension. Oh, I'm already 35 and I've just got married. Will I conceive or not? So it's not that. Even if you have got married at 22, if your ovaries would have behaved one way or the other, that's what it is. So that is how you have to look at it. Anisha, you're muted, Anisha.
Thank you so much for answering all the questions that we have gotten today, and all the information that you've given us is really very crucial for those women who have overcome the hurdle of conceiving and are now on the journey of pregnancy. Thank you so much for joining us and sharing with us your knowledge and wisdom about how to take care when you're pregnant after undergoing infertility treatment. So I hope all your questions have been answered for all those who are watching. In case you have subsequent questions, please do send them in. Please type in the comments and we will take them up in our subsequent sessions. Thank you so much, ma'am, for joining us on this session and answering all the questions that you've taken up. This program was supported by Bharat Serums and Vaccines Limited. And we'll be back with another show, a special one on women's healthcare very shortly. Do follow us on Facebook to get updates on our upcoming programs, and keep sending your questions. We'll always try to take them up and our experts join us in the next show.
Thank you very much, Anisha. Namaskar, and wish you all the best of health.
Thank you so much, ma'am. Thank you. Stay healthy, eat healthy, sleep well. Give your mind and soul a daily dose of positive thinking, and do come back for more. Bye-bye.